Hi, I want to talk today about some pediatric issues, in particular colic and reflux. Um, I'm going to tell a quick story. As a chiropractor, we see tons of infants and children and for a variety of different conditions. My original job degree was in sports medicine, and I used to work in physical therapy. And when I was working in a physical therapy clinic, I had a patient come up to me 25 years ago, and they said, "Hey, I heard that for things like colic and things, chiropractic responds well. What are your thoughts?" And to show you how far I've come over the last 25 years, I literally got filled with rage and anger, and I said to the person, "Any chiropractor that adjusts a baby should be in jail." And that's literally what I said. I remember saying it like yesterday, and I remember getting filled with anger. Now, here's the funny part about that. I knew nothing about chiropractic. I knew nothing about pediatrics, but that just didn't make sense to me because at the time, working in a physical therapy clinic and having a degree in sports medicine, I said, that makes no sense why you would take an infant's head and adjust it, and then how does that possibly relate to the digestive system? Well, we're going to talk about that right now. So, and as that progressed and I became a chiropractor, I literally said, well, I'm being a chiropractor so I can focus on more sports medicine stuff. Then as I got into it, I got a lot of my own health issues, chronic allergies, chronic headaches, all kinds of digestive stuff. I had a million things going on with myself, which I don't want to go into now, but I got a lot of that resolved through chiropractic, through allergy testing, allergy treatments, all kinds of stuff. And as that evolution went on and on and on, I became a chiropractor and I ended up having my own kids. So when my wife was pregnant, I wanted to learn as much as I could, so I took some pediatric classes. And at the time, I didn't know anything. Now I'm really glad I did because we see tons of infants and babies and kids and help them with a variety of different things. So when it comes to colic, let's just look at the definition of colic. The definition of colic is having all kinds of different issues, uncontrolled crying, sometimes vomiting, constipation, all kinds of things that they don't know what causes it. So it's basically uncontrolled crying or irritability for a certain period of time of which we don't know the cause. So that is like the definition of colic. And yet many people will say, I don't know what chiropractic's going to do, what this person will do, what that'll do. And yet the definition of colic itself is we don't know what's wrong with your baby, right? But people will walk around going, oh, we've been up every night for the last 6 months, but the doctor said it's just colic, they'll outgrow it. And we somehow think that makes sense, right? So part of what I want to get through to patients in these videos is going back to our roots and our gut and listening to our common sense, okay? So when it comes to how do we treat reflux and how do we treat, which is probably the most common symptom of colic in particular, there's a few different causes. Everything we do on everybody, there's typically physical, nutritional, and stress-related causes. Obviously, infants don't have as much stuff related to stress, so we're focusing more on physical and nutritional. So, of course, there's common things like dairy allergies and things that you can read about on the internet. But where we tend to have success is most infants, when they're born, the birth process is very stressful. I watched many videos on this where the doctors, pulling and pulling, using forceps, doing all these things, whether it's vaginal or C-section, doesn't really matter. They're pulling. I can tell you for my daughter, my wife ended up having to have a C-section after 30-something hours of labor. And as they're pulling my daughter out, they're pulling, and finally they pull her out, they hold her like this, and they hand her to me and say, watch the neck. Right? After they just pulled with I don't know how much force. So it's very stressful, the birth process. And as we know, infants' necks are very delicate. So very important, we recommend all infants, I would like to see the day when they get checked in the hospital by a pediatric chiropractor. It's just standard of care, right? They do their APGAR scores, they do this, they do that, and then the chiropractor comes in and checks them. It would prevent a lot of problems, right? Before I die, I'd like to see that happen. And so right there in the OR, you know, they examined my daughter and then I examined her and I ended up checking her and she was way out of alignment. And so we were able to gently adjust that. We've got videos on our website of me adjusting a few babies and you can see how gentle it is. Some of them slept through the adjustment. So we're literally adjusting with about the same force as you would to check the ripeness of a tomato. So it's very, very gentle. But why is that important? Because the brain controls everything, and the nerves in the upper neck, they control all kinds of functions, but in particular there's a nerve called the vagus nerve, which is cranial nerve 10. It actually controls all your autonomic nervous system, in particular your digestive system. So if that nerve is pinched or choked or interfered with, which it very often is after delivery, then you won't get the right signals going down to your stomach, and therefore they're unable to digest, and then they end up spitting up and being irritable and getting a lot of gas. So you can imagine if they're not digesting, then gas builds up in there, and that's probably the most common cause of colic, right? So by gently doing a few adjustments in there and also working on the cranium, so we're trained in what's called craniosacral therapy, we can gently mold the head to take some of the pressure off of that, because we've got several nerves that exit out of the back of the head there, and if the head is a little bit shifted to one side or the other, then that can also interfere with those nerve transmissions that are coming from the brain down to the stomach and down to the gut, okay? So how does traditional medicine treat that? Very often they're using medications, okay? Now, does it make sense to you that an infant that's weeks or months old would have to go on an acid blocker, right? No, that should not make sense to you, right? They haven't been under stress and all the things that would typically affect us as we get older. So when they're giving the medication, one of the things that a lot of the studies are showing now is when you turn off their acid, they're not able to digest properly, and then they end up developing all kinds of food allergies and food sensitivities, which leads to things like a huge increase in asthma and allergies, autoimmune diseases, all kinds of chronic pain syndromes and things. We're seeing kids at 3, 4, 5, 6 years old. We're doing blood work, doing other things. Things are completely off that you would never think of in a child. And sometimes the pediatricians don't even want to investigate or look into these blood panels and different things. So it's really a scary world out there. There's all kinds of studies about how toxic the world is. They've done studies of the umbilical cords and found over 200 known toxins in the umbilical cords of newborns. So we're not being born into a healthy world like we used to. So we have to take into consideration, and we have ways to test all those things and naturally treat all those things. So going back to the reflux and the colic, there's a lot of things we can do to try to get to the cause. There is always a cause. We may not always find it, but there is always a cause, right? The cause is not a deficiency of medication. And, you know, we've got so many great stories, but, you know, the one I want to share was we had a patient of ours who was best friends with a pediatrician. And the pediatrician ended up having a child, and that baby ended up having severe colic, severe reflux. And they were practically begging them, would you please bring them in? And the pediatrician said, no, I would never do that. And I said I'd be happy to talk to them and whatever we could do to support them and talk about it scientifically. Didn't want to do that. But for 6 months, they had to hold the baby upright for 45 minutes after every meal. And as you know, babies are sometimes eating every 2 or 3 hours. So what I want to ask you is, does that make sense? Does it make sense that you should have to hold your baby up for 45 minutes after every meal? And by the way, a lot of my patients are being told that by their pediatricians, right? So I'm not saying don't go to your pediatrician. Everybody needs a pediatrician, but just remember your pediatrician's trying to make sure that there's nothing wrong and nothing seriously wrong. That's their job. So we want to just keep that in mind as we are looking at this from a holistic perspective.